already the part completion exams, PCTs, right? And you are wondering like how to proceed with the three subjects, obviously, which are number is very less, but yes, they are big chunk of your MBBS because that is a first stage of your MBBS, isn't it? So, guys, about talking about the three subjects: anatomy, physiology, biochemistry. Biochemistry is, though the number of competencies in biochemistry are comparatively less from anatomy and physiology, the number of teaching hours are less. But the only thing about this subject is that this subject evaporates very fast, like it's like kind of volatile, and we always wonder like what to remember, what to mug up, what to keep on reading. Should I focus on only MCQs? Should I focus on structures? Should I focus on diagrams or flowcharts, etc., etc.? So, guys, today I am here to give you some tips, right? That how to ace the biochemistry for your first year exam, right? That the most important is the first year exam. So, guys, in first year exam, first of all, you joined in, let's say, September. So probably your exams will be over by, August and or the mid of September, right? You will have two theory papers, paper one, paper two. Okay. And there will be division as per your university because every university has their own different, kind of division of the course, isn't it? So that you can follow, right? So that is the first thing. Then second thing, you need 50% for passing, but never think of 50%. Obviously, you guys have worked very hard to enter into MBBS. So obviously think of something higher and more achievable that you deserve, right? So second thing, apart from theory exams, you'll be having practical exams. They will also have the same amount of mark distribution. If it is 100 is theory, 100 will be, let's say, practical. Okay. So that is also very important exams, practical exams. Fine. Now, guys, in exams, you will be getting questions which will be mostly like, let's say, the long answer questions. Okay. So you will have something that is called as long answer questions. Fine. LAQ. Okay. And this LAQ will be around 10 marks or maybe up to 15 marks, depending on your university. So guys, these LAQs will be structured and may be based on the case scenario, right? Let's say the case of diabetes they will give you, and then they will ask you the questions on that. Fine. And then you will have the short answer questions. Okay. Short answer questions can be of two types. They can be directly based on the core concept. Okay. Core concept. Like core concept is like, tell me the functions of folic acid as a one carbon carrier. Okay. That can be a core biochemistry question. And the other question that you will get in exams is like, the whys, the reasoning based question. Okay. So you can also get the reasoning based question. Like suppose if I ask you like why in a patient of phenylketonuria there is mental retardation. So then you have to explain that. So why there is mental retardation? Why the patient of jaundice, may present with, the baby have jaundice may present with kernicterus. So what is the cause of kernicterus? Like for example, okay, why ammonia is toxic to the brain? So why like vitamin B12 and iron should be supplemented during pregnancy? So there can be a lot of questions, guys, you can get in the form of whys. So always keep this whys in your mind. Okay, always start with the why. First of all, when you're starting a topic, even the simplest glycolysis, you should have the idea that why I'm reading this topic. Sometimes we are reading the whole topic and we are wondering why I'm reading this, right? Suppose you are reading HM patient. So why I'm reading HM patient? The first thing is like because it produces two things in my body. Okay, that is like NADPH or pentose phosphate, which can make the DNA or the fatty acids. Like NADPH is used in making fatty acids. So reasoning based question will give you the charm of understanding the biochemistry, right? Because otherwise if we start with mugging up the pathways like first step, second step, third step, okay, that is also good, that is your memory is good, but ultimately nowadays the questions are based on applied aspects. Okay, applied aspects. And even these will help you in your NEET PG journey also, like applied aspects of certain questions, certain topics. So they will be helping also ultimately when you will be appearing for the PG exams after completing your MBBS. Obviously, I would not say right now to think about anything like a NEET PG or any other exam, but a lot of students ask me this question, ki, sir, what will be the pattern in NEET PG, or what I want to go to US and I want to prepare for USMLE exams. So that is fine. That is good. You can start from the day one of your MBBS for these exams. Okay. So the first thing to keep in mind is that biochem is not about mugging up. It is not about mugging up at all. It is about understanding the concepts. Okay. And biochem will hold very important part in your future NEET PG exams also, because the problem with this subject is that it sometimes stays isolated in some areas. A lot of things we can correlate directly with a lot of other subjects, but still there will be 30 to 40% of the biochemistry that will stay isolated from the other subjects. So that makes it more important also, right, for the exam purposes. That may be future exams or maybe your first year exams. Okay. Now, in your first year exam, right, in your first year exam, you should be able to answer the long answer question. Short answer question will be like based on core concepts or the reasoning or the applied aspects. Okay, application part. Okay, like how can you, like, suppose if I have a knowledge of one concept that cancer cell uses more glucose than the surrounding cells. Okay, so what is the application of this knowledge? This knowledge can be applied in understanding some techniques that we will read, like PET scan. There is one scan called as PET PET scan, which will identify these cells because they will take more glucose compared to the surrounding cells. Okay, more glucose than the surrounding cells. Fine. So hope you understood, guys, right? And guys, then apart from long answer and short answer questions, we'll be having MCQs. MCQs. Guys, what is beautiful about MCQs is that they will test your knowledge and they will help you in minimizing the mistakes in exams. Okay, because suppose if I read a topic, like let's say even the glycolysis. So when I read a glycolysis, I have two enzymes here, PFK1 and PFK2. Okay, let's say I read urea cycle, there is one enzyme CPS1, but in pyrimidine synthesis, I have one enzyme called as CPS2. Fine, CPS1, CPS2. So ultimately, when I'm practicing the exam, MCQs, I'll be getting these two options, like which of the following is a rate limiting step of urea cycle, and these both will be in the option. So I'll be able to remember more. If I commit a mistake, was it one or two? Huh? So if I mark two, right, CPS2, then I'm doing the mistake, right? But then I will remember it always. Okay, it was not two, it was one for urea cycle, and CPS2 for the pyrimidine synthesis, right, guys? So that way we can actually understand the topics very clearly. So always, I believe, guys, once your topic is done, you should always do your MCQ practice. Okay, MCQ practice. Now, guys, a lot of questions that student ask me is about, like, for example, what books to approach. Okay, so what are the books to approach? See, it depends, first of all. It depends like what is your target. Sometimes your teachers will ask you to read only this book. I don't want to see this or that book in your hands. If I see that, I will not allow you in the class. No, it may happen. Like always read Harper, else I will not allow you in the class, or like that. But guys, I would suggest you one book. I will not give you the multiple option. I'll give you only one option for the theory, biochemistry, for your first year and even for any future exam. Lippincotts, right, guys? Lippincotts is the best book. Okay, it is very, very interesting and very easy to understand language. Diagrams are very beautifully made. And after that, in the end, they have very less questions, no doubt. The number of questions are not high, but they are one of the best questions that they have given that will test your knowledge beautifully, right? So, my suggestion for theory is Lippincotts. Okay, lipid gods. And guys, for practicals, again, I would suggest if you have already the practical books, some colleges and universities already giving you the printed practical books, so follow them. No need to buy any other book. But if you are supposed to buy anything, then there is a book that is by Dr. S.K. Gupta. Fine. So Dr. S.K. Gupta, that is one of the best book for the practical exams. Okay, that is no doubt. It has given all the questions which are based on Viva and principles and the test results, even the tables that you can draw in the actual exam. So everything is given here. So no need to refer to any other book. If required to buy, then buy this S.K. Gupta. So guys, no other book I would suggest. Fine. No doubt you may have bought other books, but it doesn't matter. If I would suggest, this is the only book, because this is the book for you know our exam patterns, NMC based patterns, and more of the whys, more of the diagrams, more of the better the flowcharts, and better understanding of the clinical concepts. That is all done in Lipin course. So guys, go with this, because right now you're in the early phase of MBBS and you can start with this. Okay, trust me, this is one of the best book. Okay, now, okay, I'm not doing any advertisement of Lipin Courts. I'm not the author there. Fine. So, but I love this book. So that is the point. Now, guys, in biochemistry, I'll tell you today that what are the concepts that you have to keep in your mind while studying. Okay, guys, there are some 8 points, right? Or maybe 9 points, I will write. These 8 to 9 points you have to follow in each topic that you are reading. So in your biochemistry, mostly we have metabolic section, that is carbohydrate metabolism, which is a big chunk, lipid metabolism, and amino acid metabolism. And then we have the molecular biology, and practicals are separate. So whenever we are doing any chapter, right, suppose even the glycolysis or even the vitamins or whatever, so we should follow a plan. Right, guys, what is a plan? Yeah, what are the points that you should always keep in mind? Okay, so points to, I would say master, right, for your MBBS first year exam. Okay, MBBS first year biochem exam. And guys, these are the also the points that you can highlight in the long answer question. Fine, in the long answer question. So what are these points that you should start, always finding in your chapter? So the first point that you should always find is that the what is the site or location of this particular pathway that you are reading, right? Like suppose you are reading a topic of urea cycle. So the urea cycle occurs in both mitochondria and cytoplasm. Suppose you are reading only glycolysis, that is only glycolysis happens in the cytoplasm. Then suppose you are reading gluconeogenesis. So gluconeogenesis occurs in 3 parts of the cell. That first starts with the mitochondria, then cytoplasm, and then endoplasmic reticulum also. Okay, so that you should know, guys, site or location. Then sometimes you will find that question is, which of the following organ makes ketone bodies? So the answer is liver. Then you will find the question, which of the following organ cannot use ketone bodies? Guys, again the answer is liver. And then they can ask you why liver cannot use the ketone bodies. So that is a different point. But first thing is site or location. Like ketone body utilization cannot be done by certain cells like liver and RBC. Okay, so this way you will be, remembering more and more points, right? So site or location is very important. Fine. Then number two, like guys, RBC doesn't have mitochondria, so RBC cannot use fatty acids and the ketone bodies and the amino acids as a source of energy. They only depend on glycolysis, that is glucose, as a source of energy. So you should always remember site or location. Then second thing is we should always target, guys, function of the pathway. Okay, function, or you can say the purpose. Purpose, I know it's a little heavy word, right? Difficult to find in life also sometimes, but the function, so suppose I told you in the beginning, like if you are reading HM patient, So guys, in the HMP shunt, you should be able to identify like what is the function of the pathway. Like it is making NADPH, and what is the function of NADPH? Like it never makes ATP, for example. It doesn't make ATP. It only used in the fatty acid synthesis or steroid synthesis or cholesterol synthesis by reductase group of enzymes. Okay, so it's not something which is used in energy production, like one NADH gives me 2.5 ATP, but this doesn't give me ATP. So NADPH, which cell makes it, which pathway makes it, what is the use of NADPH, etc. Okay, like it maintains the glutathione in reduced state. So why like in G6PD deficiency there is hemolytic anemia. So here we will come to these points like special importance of NADPH and its function you have to mention in the exams. Fine. So function or the purpose you have to remember. Then third thing is that we should always remember uh, while doing the chapter. So what is the third thing that you will always remember? The third thing is the rate limiting enzyme. Okay, rate limiting enzyme. So guys, rate limiting enzymes or rate determining steps. So these are the steps which will control the pathway that will not be done all the time. Suppose if you consume after your dinner, right, after your dinner, and it's almost 1.5 hours of your dinner, and you had a very good dinner, right, full of carbohydrates and sweets and everything. Then after 1.5 hours or 2 hours of your dinner, again you took suppose a glass of Coca-Cola. Fine. So that means what? Again you have taken a high amount of sugar, very high amount of sugar. So that sugar or glucose will never be used in glycolysis because you're already having sufficient energy. So this comes into play now because our glycolysis is rate limiting step. It has regulation. It is not freely available that whatever the glucose comes in our body that will be utilized for making pyruvate. Okay, so there is the importance of rate limiting. Fine. And guys, then we should know apart from the rate limiting enzymes, how they are being regulated. Okay, that is regulation, right? Like if I say glycolysis is activated by fructose 2,6 bisphosphate. So, we will understand the concepts again while reading glycolysis that fructose 1,6 bisphosphate is a normal product of PFK1, that is a rate limiting step. But PFK2 is one more enzyme which will make fructose 2,6 bisphosphate. So, this fructose 2,6 bisphosphate is not a normal product, but it activates the glycolysis itself. So, always talk about regulation. Okay, like which hormone activates gluconeogenesis? So hormonal regulation. Which hormone inhibits the glycogen degradation? Like that. So regulation is very very important, and regulation can be hormonal and allosteric. So we always talk about two regulations in biochemistry, and we should always look for these points in your book: hormonal and allosteric. Okay, these two regulations. And it's okay if there is no hormonal regulation sometimes. Like in urea cycle, we generally don't talk about any hormonal regulation. But we talk about something very important called as allosteric regulation. Like when we say like N-acetyl glutamate activates the CPS1, and this is obligate allosteric activator. Obligate. This term we rarely use in biochem. Obligate means 100% required. Without this, urea cycle cannot happen at all. That's called as obligate. So guys, this way, always focus on regulation. And guys, these are not just points for theory. These are also the points for Viva also. We make complicated things. We watch sometimes a lot of videos and we make things complicated. If we follow these rules, we can master the biochem easily. Right? See, examiner is not much interested to ask you very complicated flowcharts. Like suppose purine synthesis. It's a long, long pathway that they will not ask you. But some simple pathways, like if I say beta oxidation or urea cycle or glycolysis or gluconeogenesis, reversal of glycolysis, they are the common ones that the examiners ask. Okay. And all the questions are based on these points only. Right? Like number 5. Now, guys, number 5 is what is the coenzyme? That means vitamin. So, coenzymes are like vitamins. Okay. Or what are the cofactors? Generally, we say metals or minerals as cofactors. So like, if I say all the kinases, okay, all the kinases are dependent on magnesium. So that's it, like, one of the cofactor. So I study kinases in, let's say, first of all, in glycolysis, there are four kinases actually. Three are irreversible, one is reversible kinase. So all these kinases are mostly dependent on magnesium. Some may be on potassium also, but magnesium is the most important mineral for kinases. So, side by side, I will study vitamins maybe very late. Some universities or some colleges may taught early in the, course. But generally we take vitamins very late in the metabolism, almost end of the year. So vitamins are not different, guys. Vitamins are same, biochemical function of vitamins and minerals we are already reading with the metabolic section. So we don't have to wait ki when the vitamins will start, I will read them again. No. If the question is like, biotin activates all the carboxylases. So I remember all the carboxylases already, like fatty acid synthesis uses carboxylase. So that is biotin dependent enzyme. So this way, guys, we can easily, keep on correlating with the at least biochemical function initially. Later on, I will read about, okay, ki thiamine activates PDH, but thiamine deficiency causes beriberi also. But that beriberi also is dependent on the deficiency of PDH or alpha ketoglutarate of Krebs cycle. So the mitochondria is not functioning, energy is not produced, and that's why the heart fails. So everything is, guys, correlatable. It's not something that you have to do differently. Fine, it's like, go with the flow, keep on reading these points. Number six. So apart from coenzymes and cofactors, guys, we should know diseases or disorders, right? So nowadays, most of the questions you will get on, at least, long answer question you can get on disorders. Like, suppose, let's take simple example of diabetes, okay, or urea cycle disorders, or the jaundice, or let's say the alcoholism. Okay, like a person is consuming alcohol for the last 10 years and he is presenting with, let's say, hypoglycemia or the lactic acidosis or the fatty liver. Fine, these are the points given. His TG level, triglyceride level was this much. So then they will start asking me the question like, why there is hypoglycemia in a patient of alcoholism, right? Yeah, why the fatty liver develops in a patient of chronic alcoholism. Yeah, draw the pathway, mention the pathway of alcohol metabolism. Fine. So it will be simply like this way. So we should focus on every chapter probably has small point on disorders, right? That may be mentioned in your books. Okay, or that may your faculty may be teaching you if it is not in the books. So always follow your faculty lectures, and that you can also follow. If it is, taught in the class specially, you should know that something special was taught, which is not part of, let's say, not given in the books. So you should know that, right? So there's disorders nowadays, very important questions, disorders. Okay, because NMC is trying to make the curriculum as more and more applied aspects. Okay, why this happened, why that happened. So every question, core concepts will also start with the detailed version of a clinical case, right? Like mention the alcohol metabolism, steps of alcohol metabolism. But question was actually clinical and then more clinical points. Part two is like, why hypoglycemia and alcoholism, etc. Why polyuria, polydipsia, and diabetes? Why ketone bodies in the urine of a patient of diabetes? Like that. Fine. So disorders. Then number seven, we should know, guys, how many ATPs. Okay, ATPs used or produced. So energetics. You can say the word energetics. Fine. And this is one of the very easy question in biochemistry that, simply if I ask you the question in Viva, that how many ATPs are produced in glycolysis, you would say seven. Then I can ask you how many ATPs are used in gluconeogenesis in the reversal pathway. And you could say like six. So hardly 4 or 5 questions of ATPs in the biochemistry. And let me tell you, okay, glycolysis, 7 ATPs made. Beta oxidation of palmitic acid, 106 ATPs made. And then if we talk about the usage, then gluconeogenesis use 6 ATPs, protein synthesis use 4 ATPs, okay, and urea cycle use 4 ATPs. So like that, that's it. We are done, almost done. hardly 1 or 2 questions may be there. Like acetyl-CoA produces in the Krebs cycle 10 ATPs. That's it. Okay, so ATPs used or produced. Always look for. Sometimes you don't have to look for, like, when we are reading glycogen, suppose we don't have to find these points. Okay, like ATPs and all. So number 8. Then adjunction, guys, for example, there are some pathways which doesn't produce any ATP and use also zero ATPs. No ATP produced, no ATP made. Like adjunction, zero. Okay, like alpha oxidation of fatty acids in the peroxisomes, zero. ATPs may be made. Uronic acid pathway, which is making glucuronic acid, zero ATPs. So like that way. So ATPs used or produced. That should be, HMP at least we should know it doesn't use or produce an ATP. Then guys, number 8 is we should know the link with the other pathway. Okay, link with the other pathway. If it is there, right? And if it is not there, try to make yourself based on your knowledge. Like suppose you are done with carbohydrate metabolism and now you are doing lipid metabolism, right? So in the lipid metabolism, you found a concept that beta oxidation of fatty acids provides energy, that is 6 ATPs, for the process of gluconeogenesis. Okay, so actually, why we are storing fat? We are storing fat so that we can use this fat in the emergency for maintenance of our blood glucose during fasting state. So that's a link. Now, beta oxidation provides energy for making glucose. That's a carbohydrate metabolism. So beta oxidation is required for making glucose, which maintains the blood sugar level. But then there is one more question, that can fats be converted into glucose? Can fats give the carbons to make glucose? Then your answer is no, zero. No, it is not. There are reasons for that you'll study. Okay, so this way, guys, you can understand and remember more. Huh? Have you ever thought like why we are storing fat all the time? Huh? So this is the reason why we are storing the fats. Fine. And everybody stored more fat during the Diwali season, including me also. So link with other pathway, guys, you should remember. So that's the last point in the points to remember. Then guys, you should know the process occurring in the fat state, whether the process is occurring in fat state or the fasting state. You know why? Because if I know this, I can remember few general concepts. Like, if the process occurs in fat state, there will be increase in the insulin. And that's a process generally we will be doing mostly anabolic processes we are doing in the fat state. So we are doing what? Anabolic processes in the fat state. And one regulation point also we can understand, guys, that insulin causes, let's say, dephosphorylation of most of the enzymes. Okay, dephosphorylation. So this is a way insulin regulates enzyme by removing phosphate, because enzymes are proteins now, by removing phosphate from the enzymes, that is proteins. Okay, because insulin activates some enzymes called as protein phosphatase, which removes the phosphate from the enzymes. So increased insulin. And in the fasting state, guys, there is increase in the levels of various hormones, which are stress hormones. But one of the important hormone is like glucagon. So glucagon causes, let's say, phosphorylation of most of the enzymes. So that is also a regulation point. And guys, in the presence of fasting state or glucagon, generally I'm doing what? Catabolic state, catabolism, right? Like beta oxidation of fatty acids or maybe the gluconeogenesis, etc. So I am doing the catabolic processes during the fasting state. Got it, guys? But some pathways may not be affected much by insulin and glucagon, right? Or the fat or fasting, like urea cycle, suppose. Urea cycle will happen in the fat state also because I'm consuming proteins, and in the fasting state also because my cells are dying. Normally everyday cells are dying and cells releases all the proteins into the proteins are released and these proteins are degraded to amino acids and amino acids are converted into urea, nitrogen converted into urea. So this way, guys. Okay. So these are the points. Again, I'm repeating. You should know site or location, function of the pathway, rate limiting step, how the rate limiting step or the other things, how it is regulated, Coenzymes, that is vitamins and minerals, disorders and diseases, nowadays very important. ATP used and linked with the other pathway. And guys, last point I can write as inhibitors. Okay, inhibitors or poisons, though very less in the biochemistry, but wherever it is, this is one of the favorite of examiner. Inhibitors or poisons. And guys, let me give you one trick for exams. Whenever there is a question in exams, right? Always highlight these points. Plus, just add, even if it is not asked, now just add something clinical related point. Okay, if you add something clinical, then it will be very, very beneficial for you. Like, this gives a better impression, even in the Viva. Even in the Viva, if suppose if I ask you, like, name the uh, enzymes which are tested in LFT, and you would say like ALT and AST. And then you can say directly, you say ALT is more liver specific and AST is not liver specific. And ALT increases mostly in the liver damages, but AST may increase also in the heart and muscle damage. So like that. Okay. So just even in the theory, you can do this. There was even a plain core biochemistry MCQ that is like, suppose there was regulation of gluconeogenesis, but you just mention few lines about clinical concepts like, alcoholism causes inhibition of gluconeogenesis, and that's why there is hypoglycemia or something else. If you know already these concepts, at least you will be known by the end of your session, that is before your university exams. And so you can mention these things in the pre-university and university exams, both, which are the major exams. Fine. So with these 10 points, and you will be the master of your topic. Okay. So, what to do? Keep on writing these topics. And guys, don't forget that also look for PYQs of that topic. So PYQ of that topic means what was the question asked in the last 5 or 6 years of university exams. So that must be already in with your seniors or everybody, right? So take the PYQs. Like, suppose there was a question on gluconeogenesis, and there was a PYQ that what are the substrates of gluconeogenesis. So that was it, maybe just 2 marks question. But you should always mention this, right? In the book, in the end of the chapter, or maybe the beginning of chapter, you can mention this that okay, in the last 5 years from gluconeogenesis, this question was asked 1 time, 2 time, 3 time, whatever it is. Like in urea cycle, they have asked every year urea cycle, draw the urea cycle and disorders of urea cycle. So PYQs, guys, don't miss the PYQs. Very important. Don't depend on PYQs. Get your knowledge updated. Read everything which is taught to you, right? In your curriculum, whatever is taught, read everything. Because we can't rely just on PYQs. But there are high chances that you will get at least 50 to 60% of your paper from the PYQs. It is generally what faculties do. Even I'm the faculty, so I know this. I can tell you this. Okay, right? I'm also the one who is making papers, giving exams, taking exams, not giving exams. Fine, guys. So that is PYQ. You should remember. Now coming to the pathways. Sometimes they feel very difficult. Okay, what to exactly remember. So guys, what is easier way to go through a chapter is that first go through the chapter just like this. Okay, what is the function and why we are reading this? So what goes inside? Suppose glucose goes inside. What comes outside? Pyruvate comes outside. What happens to the pyruvate? Converts to acetyl-CoA. So just go through this like me. I don't have to read the 10 steps of glycolysis. Just go through these 2 points. And like what urea cycle starts with ammonia plus CO2, right? Like this. And how it ends again, why we call it a cycle? Because ornithine is generated in the last step, and that comes back to mitochondria. So this way, just look at this point. Then go through the again, after this first reading of basic things, that basic things means like okay, what is the importance of this pathway? What is the main product of this pathway? What is the main function of this pathway? Where does it happen? Then read, give a read after 15 minutes of first reading. Then give the 30 minutes of next reading, which is detailed. Okay, 30, 45, depend on the chapter's length. So then gives our next reading. And now you concentrate on rate limiting step, most importantly, regulation, most importantly, and diseases. Okay. So that will be your second major reading. And there's what is the third reading of the same chapter will be that just close the book once you have read and just try to revise what these 10 points if they are in the chapter, because every chapter will not have inhibitors, every chapter may not have ATP role. So whatever the points out of these, they should be tips. Okay, I have to remember in this chapter these points. Okay, like rate limiting step, what is a inhibitor, what is a regulation, what is a ATP used, what is a diseases caused, etc., etc. What is the vitamins used by a particular enzyme? Like phosphorylase of glycogen phosphorylase is B6 dependent, which is rarely used in carbohydrates because B6 is mostly used in amino acid metabolism, right? So this way. So get the PYQ, revise in the three pass method. This is called as three pass method actually. So three pass method means just look at the overview first, what goes inside, what comes outside, where does it happen, what is the function of this overall pathway, then detailed overview, and then close the book and try to remember these points and you will build a good memory. Okay, and guys, memory will be built only if you see the same page again and again, not by different books. So keep your source of information only one, not multiple. Hope you understood. Okay, so that is your point to remember. Okay, that's how you should follow. Then there's some more question that of structures we don't have to remember much. Structures are rarely asked. Okay. Some graphs may be important like in enzymes. So wherever the graphs are there, always try to remember them. Like, even in the MI, you can see the graph like, what is increasing first, what is increasing second, etc. Then you can see the graphs of, let's say, line view, Berg plot, and enzyme inhibition, Okay. You can see the graphs of that also. Like identify this graph, which is, I can say maybe the graph of metabolism, non-competitive inhibitors, etc. Right? So identify the graphs. And then there is coming to the part that is called as practicals. Fine. Practicals are very easy. In the practicals, you have to follow the, one thing that is, you should know the steps first. Like, first I'll take this, then I'll heat it, then put the few drops of this reagent and that reagent. So steps. Then second thing, principle is the most important. Actually, the examiner is more interested to know principle. Okay, even if you have done the, sometimes if you have done the reaction wrong, right? Test wrong, you didn't got the color, suppose you didn't got the ring in the Rothera's test. Even then, you should know the principle, the name of reagent, etc. You should know the principle part. What is the principle behind this test? Okay, like why the beta hydroxybutyrate is not giving positive Rothera test. So you should know the principle because we need keto group to get the purple ring, first thing. So principle you should know. Then, guys, in the Viva, what they will ask you. So in the Viva, they will ask you, most importantly, guys, what you should know. You should know the normal range. Okay, normal range. And then you should know the clinical conditions in which the range is deranged. Okay, clinical conditions like glucose, like one of the very common question that sometimes students, I would say more than 40% students are unable to answer this sometimes. And what is the normal range of blood sugar in fasting, in PP, right, postprandial, and in random? And how will you diagnose diabetes, right? So that is the least expected question if you have got Benedict test or if you got the glucose estimation in the serum. So we must remember the normal range and the clinical conditions causing the derangement. Obviously diabetes here, but in other topics, okay, like proteins or something. So clinical conditions are very important. And please don't speak the hi-fi clinical condition. Huh? Like if there's a question on like, why there is jaundice in this patient, and you are saying it's a jaundice may be caused by the, let's say a patient who is presenting with a carcinoma of the head of the pancreas, which is causing damage to the or blockage to the biliary canal equalizer, etc. Right, like that. So no, stick to basic first. Examiner wants to know if you have the idea of basics first. Don't say anything high-fi words. Fine. So normal range and clinical conditions. And that's it, guys. Right? Okay. And one trick is always like that works in Viva is you can change the questions to the topic you want. Huh? If the examiner is asking you something that you don't know, just change the topic and tell something that you know about related to that topic. And suppose there is a diabetes viva going on, and examiner is asking on something like the change in the lipid parameters in diabetes, and then just you can change the point to HbA1c or ketones if you know about ketones. That is also one trick that you can follow during the exams, right, guys? So don't worry, biochem will be very easy. Just follow these points that I have mentioned you, and you will definitely ace the subject. Stick to one book, make the long-term memory, right? Because you have 1 year almost, or maybe let's say 9, 10 months now. So that will be sufficient to get these subject easily done. Biochem is not very big, and it is very easy subject if you stick to the principle. But the only problem with biochem is it is highly volatile. If you don't revise in time, you will not be able to remember much. So revise in time, keep revising, keep every day fixed time for each subject. Suppose biochem you can keep even 1 hour for every day, right? And guys, one more thing I can tell you, if you know that what is the topic being taught tomorrow in the lecture, just read overview at least 15 minutes. What is going in, what is coming out, what is a rate limiting enzyme, what is the function of this pathway, why I'm reading this, what is the name of disorder, at least name at least. Okay, like fructose as hereditary fructose intolerance, like that. Okay, so that way you can ace any subject, not just biochemistry. So follow these 10 points in biochem and let me know, right, if you're able to ace this subject very well. So guys, thank you so much, and I wish you all the best, right? And for any query you can ask me also. Plus, I would suggest that stick to one source of uh, you know information always, right? And you can also opt for the DocTutorials video, which are made in that way only. That is very short, crisp, and stick to the exams, right? No unnecessary information, and they are not very much extensive, unnecessary extensive, right? Okay, they have the complete information, but in the crisp and detailed manner, right? Okay, thank